Well, thank you very much for inviting me to come and speak today. I think it's been a fascinating morning so far, and I think what's been one of the most interesting things is how different people who use care services, who receive care services, who deliver them, are all saying the same thing, and we're hearing some really key messages. So I'd like to tell you a little bit about the work of the Care Inspectorate, and then offer some thoughts around how we might contribute to some of the debates that we've had this morning. So the Care Inspectorate was founded in 2011 when the old Care Commission, the Social Work Inspection Agency, and some child protection functions from Her Majesty's Education Inspectorate came together. And our job is to provide public protection and assurance and to support improvement where necessary. So it's a really good question, actually, whether the Care Inspectorate is a regulator. We see ourselves as much more than that, although it does mean that we do have to register care services. It's unlawful to operate a care service in Scotland that isn't registered with the Care Inspectorate. We inspect those services to make sure that the quality is good. We investigate complaints from the public about them where people are unhappy and they haven't been able to resolve those concerns with the service itself. And we support improvement, both in services where that needs to happen, but also nationally across Scotland. And what I thought might be helpful to do is also, before I say what was going to be helpful, we also carry out strategic inspections of services for children and adults. So looking not just at how individual services work or what's happening in a particular building, but what's happening across a local authority area. How are different agencies working together to support services for older people and for children? What I thought would be helpful would be to put some numbers up on the screen. There are 13,956 services registered with the Care Inspectorate across Scotland today, and they include childminders, nurseries, care homes, care at home services, housing support services, daycare services for adults and older people, fostering and adoption agencies, residential school care, and many other specialist agencies. So the range of work that the Care Inspectorate does is really very significant, and it isn't just about care homes, important though those are. I also thought it would be helpful to put up a number of 1 in 13. And this is a figure from the Scottish Social Services Council, who points out that in Scotland, 1 in 13 people work in social care and in the social services. So a really big percentage of the workforce in Scotland is involved in delivering social work and social care. And my final number for the morning is 789,000. And that's the number of people in Scotland who are carers, who care for a loved one or a relative. And it really underlies the point we were talking about this morning. I think it was Rosemary, actually, who's, I know, not here this afternoon, was talking about the sheer number of people who are involved in supporting care in Scotland. And of those, 50,000 of those people are young people who are carers, children and young people who themselves care for somebody else, a parent, a sibling, and so on. So I think it's fair to say that everybody in Scotland at some point in their life will use a care service, be it from childhood to the final years of life. So, big question, big part of our work is trying to assess how well do these care services perform? Are they operating to a good standard? So when we inspect a care service, we look usually at 4 things. We look at the quality of care and support. Is the care that's provided high quality? We look at when we're looking at a care home and other buildings and services in a building, we look at the environment. Is it a nice place to live in? Is it a homely environment? Is it one where people can be safe and get access to the outdoors, enjoy facilities and amenities? We look at the quality of staffing. Are staff properly trained and recruited? Are they working to a high standard? Are they providing care which is compassionate and high quality? And really importantly, we look at management and leadership. How well are individual care services being led by their managers and by the providers? Because we know that has a big impact. So we look at those things on inspections, and we carry out about 7,000 inspections a year, so a large number of inspections. And what we do is we grade each one of those themes on a scale from unsatisfactory through weak, average, good, very good, and excellent. And what I thought it might be useful to do is just show you very quickly, for a couple of types of services, how well things are performing in Scotland today. And the good news is that most services perform well. Most services across all types of service are offering a good quality care and support, and that's really encouraging. But we know that there are some services which are simply not offering the quality of care which we expect, which you as people who use services would expect, and that I think probably the vast majority of people who work in services would want to deliver to. So, in care homes for older people in Scotland, today there are 879 care homes in Scotland, and you'll see across the bottom, ranging from unsatisfactory in the red on the left through to excellent in the green on the right, you'll see where things sit. And what you'll see is that there's a very small number of services which are unsatisfactory or weak and require very significant and speedy improvement. And you'll see there's a small number of services at the top which are excellent and really sector leading in offering the care that they do. And in the middle you'll see a lot of services which are good or very good. So that is a sector which is working well and providing high quality care. Of course there's room for improvement and there's absolutely no room for complacency, but across all sectors, local authority, private, not-for-profit sectors, we see examples of excellent care. Very similar in care homes for adults. There's 326 care homes for adults in Scotland, and you'll see that actually that's a sector that performs even better than care homes for older people. More services operating at the higher level of quality. You see there almost 60% of services are very good or excellent in the care that they provide. Looking at care at home, again we see real strengths in care at home and also in support services and daycare services, where large numbers of services are operating. In the cases of daycare, the majority are operating very good or excellent, and likewise in care at home services. So I wanted to put that up to stress that there are examples of excellent quality care right across Scotland, and that's something that's really welcome. We know though that care operates in a very complex environment. Care doesn't just happen from one person or one service to somebody else. And I've put up this web of care from the Alzheimer's Society based in England, looking at all the different places that Barbara and Malcolm might get care from, across different parts of the health sector, across different parts of the social care sector, and actually from friends, from themselves, from families. So we need to think more than just what happens in an individual care service. And at the moment, we have in Scotland a set of national care standards which apply to individual care services. They're about 12 years old now. At the time, they were really quite radical in some ways, quite sector-leading, really person-centred. But they're very much based around settings, not people. And so at the moment, then, the Care Inspectorate and Healthcare Improvement Scotland are reviewing those standards and doing that in partnership with people who use care services and provide them. And what's going to be really unique about them is that there'll be three levels of standards. There'll be some high-level principles setting out really high-level principles of what people are entitled to, and that those will apply across all social care and all health settings in Scotland. So that's a really new departure, not something that's happened before. Underneath that, there'll be generic standards, things that will apply across all care settings and some healthcare delivery. So things like, what should management and leadership be like? What should quality assurance be like? And then underneath that, we'll have a set of specific standards that are much more detailed. The standards will be based around human rights and well-being, and they'll be aspirational. These aren't going to be minimum standards, they're going to be standards to which we need to aspire, and as Ranald said this morning, standards that we will use to hold the mirror up to services to make sure that they're operating at a really high level. And at the moment we're consulting on the high level principles, so if you haven't already been on to newcarestandards.scot and give your views, I'd strongly encourage you to, and you'll be able to find that online and on social media as well. So in recognition of these changes and the more complex way that care is delivered, the Care Inspectorate is changing our approach as well. And what we want to move from an approach of compliance towards one around collaboration. And that's about working with people who provide services, not simply inspecting them. So supporting improvement where necessary, but working in partnership, both with providers and users of care services. So there's a really good example of this. For a number of years now, and increasingly, we have, on our inspections, asked somebody who uses a care service to come with the inspector. So it might well be that the inspector will turn up to a care home, for example, not just on their own, but turn up with an inspection volunteer, someone who uses a care service or whose family uses a care service. And the inspector will be an expert, because they're experts in delivering care. But the inspection volunteer will be what we call an expert by experience. And they will talk to residents, listen to what they say, and feed their views back to the inspector. And we know that sometimes residents might not want to bother the inspector, or feel that an issue they want to raise isn't important enough for them, but will be much more willing to talk to someone who knows about care. So that's an example of the kind of collaboration that we want to see. But there's some key questions that I've put up, and I don't think we'll be able to answer them today, about what care services needs to think about. So thinking not just about what processes and procedures are in place, but what's the impact of those processes and procedures? What are outcomes like for people who use a care service? Thinking about how well do we uphold the new national care standards? Could we do things better? And thinking about how we can act on the views of people who use our services, not just listen to them. For the care inspector, there's some important questions too, about saying how can we be proportionate where services are performing well, but maintain rigour so that people are confident in what we do? How can we use better intelligence in deciding what we need to inspect when? And thinking about how we support care services to innovate, to do new things, and to support improvement too. But I think there's some key questions for carers as well. I think for care staff, there's some important questions about asking, how can my practice be even more person-centred? How can I collaborate with other people, maybe who don't work in my service, but work in another service, to support care for somebody? How do I listen to people's views and act on them? And that's hard when people are saying something to you which says, I'd like you to do something differently or in a different way. But also for carers who are supporting families, I think there's important questions to ask about, are we getting enough support? Are we getting information? Are the national care standards being applied here? Do we know what to do if we're unhappy? And these are some of the questions that we've talked about this morning, actually. And I think they're very important to reflect on. At the same time, then, we're testing out new types of inspections. And I won't go into too much detail, but we're trying to make sure that we have different types of inspection to support things. So if we know that a service isn't performing well, from this year we've started doing things called follow-up inspections. So a shorter piece of work, going back into the service, making sure the things that we've asked to be changed have been changed. We're looking at thematic inspections. How can we support, how can we find out about what it's like for people with a learning disability, for example, to live in a care home in Scotland? And looking at how we investigate complaints. Really important that people come to us to be able to share their concerns, but also important that when we look at those concerns, we're proportionate about that and make sure that we're investigating where that's necessary. But sometimes there might be other ways of supporting an individual as well. At the same time, as I said, we carry out what we call strategic inspections of care services and the provision of care and health services across Scotland. So for our adult services, we're currently reviewing our inspection methodology with Healthcare Improvement Scotland, looking at how we do that. And we want to support an approach of scrutiny and review which helps partnerships as we move towards integration and supports services working together. And during the next year, we're going to begin to think about some new responsibilities that the Care Inspectorate and Healthcare Improvement Scotland have from April 2017. And that's to look at strategic joint commissioning. How's that joint commissioning approach working in an integrated setting? And we're very clear that we're not going to be interested in looking and reading at a commissioning plan. We're interested in what are the outcomes of commissioning policies for people who are using services and how can we look at them. At the same time, Care Inspectorate has an important role around supporting improvement. And if any of you who use or provide care services haven't been on the website called The Hub, I would encourage you to do that. The website address is hub.careinspectorate.com. You'll find a link from it on the front page. And it's a collection of resources and materials, not just produced by the Care Inspectorate, but produced from a wide range of people, to signpost you to and your staff who work in services to access support materials and so on. And more services are using that website around staff training, staff induction and so on. So I encourage you to have a look at that. Just a very concrete example of that is that we've recently produced a support pack around promoting continence for people living with dementia and long-term conditions. And when I said that we work in partnership, this was a way in which we work very closely in partnership. And in just one moment, we're going to see a video from a man called Archie Noon. Now, Archie was diagnosed a number of years ago with dementia, and I can see some nods around the room, so perhaps some people know Archie or have heard him speak. And Archie says that he turned up one day to Ninewell Hospital to see a specialist. He likes driving his cars. He's got a little car. He turned up one day. He was told, "You've got dementia now, so you can't drive home." And his keys were taken away from him, put in the desk, and told he had to get a taxi home. And he said that he sat at home for weeks thinking, we're being serenaded by some music, thinking, well, what happens now? And he decided that he wanted to make a difference, that he wanted to live with his diagnosis of dementia and not make that prevent him do the things that he wants to do. He wanted to work with us to develop a pack about continence and supporting that. So I'm not going to show the whole pack, but I've got a short video which I'd really like you to show about what Archie's done and how he's done it.
Working group, also the research group. I wanted to make this film about continence because people don't talk about it. James Bond never has to worry about these things because he's not, as far as we know, he's not got this problem. So what we wanted to do with this film is just have a little comedy. Bring into the picture about you can laugh about it, because as we keep saying, it's embarrassing. If you don't talk to someone about it, they can do nothing for you. But once you get over that initial embarrassment about it, everything, well, not everything, most things will fit into place. You'll enjoy life. Life will be a bit easier, a bit better. So I think I'm not going to say any more. We'll just let it go at that. And I wish you all the best. And watch the film and have a good laugh, because there's a tall, dark, handsome chap comes out this little sports car and you have no idea who he is, but James Bond's got something to look out for on the next film that comes out. Bye-bye just now.
In a world where people don't talk about things, but should, where little things can make people's lives difficult, where we shouldn't have to be uncomfortable. Sometimes it takes just one person to stand up, to make us think about things. One man is on a mission to help people talk, to help people listen, to break down the barriers that prevent people from talking. His name is Noon, Archie Noon, and he's coming soon to a theatre near you because Archie Noon cares about continence.
Thank you. So, as Archie said, he has come soon to a theatre near you. On the Hub website, there's a whole suite of resources about supporting and promoting continence in care services, and you'll find that alongside a whole lot of other materials about other conditions and ways of supporting people who use services. So, thank you very much for having me here today, and I'm going to pass back to Andrew to introduce the next speaker.
Thanks very much, Rami.